Many years ago, as I was walking the halls of skilled nursing facilities and talking about person centered care and how important it is, and we have to get person centered care into the care plans, and we have to revamp how we do nursing and dietary, and the shower room should look like a spa, so on and so forth. I got some resistance from leadership saying, cool your jets, we can't push person centered care so far because we might get in trouble. Get in trouble with who? Well, state surveyors, it might be against federal guidelines, so on and so forth. So, my topic today is person centered care planning in senior care. Guidelines from guess who? CMS and DHHS. In other words, person-centered care has been endorsed by the feds, endorsed by the states, so on and so forth for quite a while. So person-centered care has been around for 20 years or more as a philosophy, placing elderly nursing home or assisted living clients at the center of their care process. It focuses on choice, independence, quality of life. Some time ago, many healthcare professionals were concerned that person-centered care would not be endorsed by the Centers for Medicare and Medicaid Services or the Department of Health and Human Services. Not only do these governing bodies approve of person-centered care, they endorse person-centered care planning. So let's talk about creating baseline care plans. Basic, right after admission. CMS and DHHS recommend developing and implementing a baseline plan of care for each resident that includes guidelines to provide effective and person-centered care, as well as professional standards of high-quality care. The plan, there's some rules to this, though. The plan should be developed within 48 hours of the resident moving into the care community. The baseline care plan should include minimum healthcare information to begin with, including the resident's initial goals based on admission, physician's orders, dietary orders, therapy, social services, and PASSAR recommendation if appropriate. The leadership team should then provide a summary of the baseline plan of care to the resident as well as their representative, family members, so on and so forth. That includes initial goals of the resident's care, medications and dietary information, services and treatment administered by the care community, and any updates that might occur to the plan. Now, let's talk about creating a comprehensive care plan, person-centered care plan. The leadership team should then create a comprehensive care plan that is person-centered, consistent with resident rights, and include measurable goals and time frames that will meet the residents' unique medical, nursing, mental, and psychosocial needs. The comprehensive plan should also describe specific and specialized services or rehabilitative care required to attain or maintain the resident's highest practicable well-being. It should be stated that the resident has the right to refuse any treatment. That is a basic resident right. The plan must be developed within 7 days after the completion of the comprehensive assessment and prepared by the interdisciplinary team, attending physician, the RNs, STNA, dietary staff, social worker, the resident, and residents' representatives. The plan should be reviewed and revised as needed and on an ongoing basis. All services provided by the care community and included in the person-centered care plan must meet professional standards of quality, be provided by qualified healthcare professionals, and reflect a couple newer things: trauma-informed care and culturally competent philosophies. Okay, so we have the basic plan, the baseline person-centered plan. Then we have a comprehensive person-centered plan. Now the residents receive therapy. They're going to go home. What do we need? We need to create a person-centered discharge planning process. Once the resident is ready to return home, a clinically sound and personalized discharge plan should be implemented and focus on the resident's discharge goals, outline risks for readmission, and effectively switch to post-discharge care. The discharge plan must identify and ensure any discharge needs, changes that require modifications of the discharge plan, and be prepared by the interdisciplinary team. The plan should also identify resident and caregiver or support person availability, capacity, and capability to provide any care required after discharge. It should also identify the resident's treatment preferences as well as their goals. Ultimately, the person-centered discharge plan should be developed with the resident's participation and include their representative, family members, who will help them to adjust to their new living environment. So I do have some final thoughts on person-centered care planning. Most senior care communities embrace the many philosophies of high-quality person-centered care and have done so for quite some time now. To better fine-tune a resident's quality of care and life, person-centered care plans can act as a personalized roadmap to guide staff in providing for their unique needs for each and every resident, from the time they walk through the community's doors to the time they return home. And healthcare leaders can be comforted, the whole point of the video, be comforted, healthcare leaders, to know that this plan, this comprehensive person-centered care plan, is endorsed by both CMS and DHHS. So, take a nice nap and come back. I'm Dr. Jim. Thank you for your time and attention. I'll see you soon. Well, I hope you enjoyed the video because we have so much more to offer if you are looking for an online learning partner for your staff, compliance requirements, continuing education, tracking, reports, the ability to share documents, send messages, even track training that you're doing outside of the system. Collins Learning is waiting to become your online learning partner, and you will receive best-in-class customer service and support. So follow the link below. Check out Collins Learning today.